Welcome back. It's Wellness Wednesday. We devote this time every week just for a segment helping us all live a little healthier.
July is Minority Mental Health Awareness Month, a time to increase awareness about resources for people with mental health issues in the minority community. Our Jordan Daphnis live in studio hosting a panel with the Oklahoma Department of Mental Health and Substance Abuse to talk more about it. Jordan?
Well, thank you so much, guys. Right now, I'm joined by Josh DiBartolo and Terrence Spain, and they are experts in this field. And first off, we want to know, what should we know about Minority Mental Health Awareness Month?
Well, first thing I will tell you is that working with the department with adolescent substance use and co-occurring disorders, we've had the opportunity to really see and understand that outcomes as far as mental health for minorities has been a struggle for us, and we want to make sure that the community is aware of everything that is going on and all the resources that are available.
What are the biggest challenges you guys are facing in your communities?
I feel like one of the biggest challenges that we're facing is still bringing awareness to what the issue is and having a clear understanding of what mental health really is. Because if you think about it, a lot of times when we have community conversations, we're still using a lot of the same words, but with completely different meanings.
Okay.
So if we can actually just address the baseline, then we can have a context to have a great conversation about improving outcomes for our mental health.
And how are you guys doing that? How are you reaching out to the community and defining those terms?
Yeah, so one of the ways that we're helping to define the terms is we're meeting the community where they're at. We're bringing in community members that know the community very well and are helping us tailor their approach to that community effectively. Terrence, would you have anything to add to that?
Yeah, I'd like to speak specifically around the African American community in Oklahoma. Stigma has been the biggest indicator of a lack of being able to get to those resources. So one of the things that we do is work with pediatricians and doctors. That is often a first level area of where you can get help for mental health and substance use, and then being able to refer out from there.
And being out in the community, working with community members, how are you helping directly break the stigma with maybe students that you're talking to?
Well, I think one of the things, like Josh said, is the language that we use. That's one direct way of really breaking the stigma around mental health and substance use treatment and services.
Awesome. Well, we can't wait to hear more from you guys. We're going to be coming back to them later in the show. Such an important topic to be talking about, and I can't wait. Thank you so much, you guys.
Welcome back. Wellness Wednesday, our special segment to help you live a little healthier.
We're talking about Minority Mental Health Awareness Month to raise awareness about the resources out there for people with mental health issues in minority communities. Let's get back over to Jordan Daphnis. She's hosting this special panel with the Oklahoma Department of Mental Health and Substance Abuse. Jordan?
Well, you guys, like we were saying earlier, there are so many resources available, and I'm joined again by Terrence Spain and Josh DiBartolo. They are two of the people working in the field, and you guys, as you are doing this, what are some of the things you're learning along the way?
Well, I think one of the major things that we're learning is that we need to start really working with our behavioral health specialists in cultural competency and being able to work with diverse communities. What else would you say, Josh?
Yeah, I mean, I think that really speaks to the diversity that we have in Oklahoma, and every approach is going to be a little bit different, but our goals and outcomes is really what we want to have: healthy individuals, healthy families, and healthy communities.
And we talk about getting these messages out to young people. In doing that, you also have to be talking to the whole family. How do you do that?
So I think one of the first things to recognize is that we have resources in Oklahoma that can help with that. Parents Helping Parents is a wonderful organization here in Oklahoma that can help start those conversations with your child and with other family members, as well as Peaceful Family Oklahoma that helps out families when there's a substance abuse issue within the family.
I think there's so many times that we have so many great resources, but common Oklahomans just don't know what resources we do have, and really just getting connected to the right ones. But, you know, we do have this amazing lifeline, 988 Oklahoma, here in the state that is open and available 24/7. And you can call, you can text, or you can chat that at any time to help get connected to resources.
You guys, something that goes through my mind is all of these resources that you name, and knowing that you guys are here, that can almost feel overwhelming, like maybe it's not in your reach as the everyday average person, but it is. How can they know and find you and know that these resources are available and access them?
Well, just like Josh said, 988 gives you access to an actual human being that'll be able to help and guide you to the resources that you need. And I think that's the easiest way of going about getting those resources, is hearing it from someone, an actual person.
Just call that number. It's so easy, right?
Yeah, it's like a no wrong door approach. So if you call it, they know which way you're going to go. They're going to get you connected to the appropriate services that you do need. And I think it's really super easy, and all you have to do is just dial 988 to make it happen.
Well, thank you so much, guys. Is there anything else that we're missing?
No, I think the one thing that I would like to end up by saying is that, you know, we're trying to help make healthier families and healthier children, because ultimately that makes for a healthy Oklahoma.
Wonderful. Well, thank you so much, Terrence and Josh. We appreciate it. These are such important conversations to be having, and I know you've made a difference for some family out there. You guys, don't forget, you can always call 988 if you need anything at all. They are here to help. Back to you guys.